So mine was more of a, I needed a hard reset of unplugging from going out and partying and all that stuff for years. And I took about a decade off. I really did, ish, 7 or 8 years from going out and stuff after I got out of the club business, got into the car business, and for the most part. And, got back into it after a while. I mean, I didn't get back into drugs, but I was able to kind of get back into going out and being able to, just drink and not do drugs to party. But the private numbers start calling early, don't they? We're not going to answer private calls. I don't know why y'all try calling with the private calls. The phone can ring all day, but we're not going to answer it. We'll put you on hold. How about that? We'll put you on hold so we can open up line two. So yeah, I don't know. Let's see here. But yeah, the mental health thing that we were talking about. If we could put the money into mental health, I mean, because all that the homeless problem in downtown Jackson, most of that stems from addiction. And I'm lumping addiction into mental health here, just so we're on the same page. Addiction is a mental health problem. It is not a disease. But you've got people down there with mental health problems that also happen to be drug addicts. They have bipolar disorder, paranoid schizophrenia, and they've reached a point in their lives where their families just they can't do it anymore. Man, I've never had a paranoid schizophrenic in the family, but like I said, I was married into a family that had a real deal active addict, and if you were ever going to convince me that that addiction was a disease, this would have been your case study to try to convince me with. But even then, I knew that if you could just stop doing the drugs, you would be cured. But they just can't stop, won't stop.